This video is going to go over topical anesthetic. We call it numbing jelly for patients so they kind of understand what it is. It just comes in this simple little jar. If we take the top off, you'll see inside is just kind of a jelly-like consistency. And we want to make sure we pull out enough to get the job done. So here's just kind of a picture showing about how much gel that is. There's another video just kind of showing the amount. Really, it's not that precise, just that amount. Now, before we place the gel, you should be aware of where we actually give the shots. For an upper, if we do an infiltration where I'm pointing, that is where I'm going to give the shot. So that's where we want the jelly to be. So you can see here in the anteriors, that's where I would go for the upper. Now, on the upper palatal, sometimes I would give a shot in these areas, but there's no need in placing gel in those palatal areas because it really doesn't do any good. On the bottom, you can see where my thumb is. I'm going to go right about where you can see where I'm pointing. There'll be a picture here in a second. That is where it's going to go, like right there. So that's where the gel needs to be in order for it to work. Okay, so this is how we're going to do it. We're going to take and swab the material up in the target spot. Leave enough gel in to make sure it's staying on the tissue. Have the little cotton roll cradled in your hands. So you can go straight to placing that cotton right over the anesthetic area so it stays kind of trapped in place and the saliva won't carry it away. Okay. If we go now to the lower, again, we're going to dry it off. We're going to apply it. Sorry, dry it, apply it, and then cover it back up with the cotton. Have the patient then close, and that will keep it trapped in place. Again, so the saliva doesn't start carrying it away from its target area. Okay, now it's been sitting there for 2 minutes. It's time to take it out. Have the suction ready to go. You take out the anesthetic. You go directly in with your suction. After you've gotten the bulk of it out, then turn and throw it away. Do not put that jelly on the tray. And there it is. It's going to get all over everything. It's like syrup. It just sticks to everything. Now here's the upper, same kind of thing. Have the suction ready to go straight in. Suction, then throw away the cotton. And that's how you place topical anesthetic. All right, thanks.